Hello everyone, today I'd like to talk about nutritional support for women before, during and after pregnancy. Even though I could talk about each of the upcoming topics for hours, my goal today is to provide common sense information to the point so it's most useful to you. I remember vividly early on in my career as a pharmacist, I was comparing prenatal vitamin formulas with standard recommendations for multivitamins, B vitamins and minerals for non-pregnant women. And I remember thinking, why are these prenatal formulas dosed so low, except for the required folic acid amount of 1 milligram, especially if daily requirements for women providing for themselves and their growing child are clearly higher than for a non-pregnant woman. During pregnancy, the female body prioritizes supplies for the growing baby. The mother sacrifices her own resources. And if the mother's nutritional status and reservoirs are not adequate to begin with, this can quickly lead to significant deficiencies of key nutrients for mom and the baby. Most important nutrients to review here today are iron, important for hemoglobin and blood formation, thyroid conversion and energy production, vitamin D3, important for fetal development, birth weight, the immune system development, both mothers and baby's mood. Magnesium, important for bone and teeth development for the baby and bone and teeth maintenance for the mother. Muscle development, energy, sleep, relaxation, and B vitamins to help minimize birth defects, help provide energy, help relieve some specific symptoms of pregnancy like nausea. Other vitamins that could be considered before and during pregnancy are vitamin C, zinc, and selenium. So let's start with iron. When talking about iron supplements, we have to begin with compliance issues due to the side effects of the more regular iron supplements on the market. Many women experience pregnancy-related constipation starting when progesterone levels rise around the second to third month of pregnancy. And it may get worse as pregnancy progresses and the uterus grows. And if you now add on a heavily constipating iron supplement, things might not go so well. And women might decide to stop the iron supplement to get some relief. Most iron salts, like fumarate, gluconate, sulfate, and even glycinate, have constipating side effects. And it is the unabsorbed portion that is responsible here, and most iron salts are only absorbed into the blood at around 10 to 20%, leaving 80 to 90% of the dose unabsorbed. And that portion has to travel through the gastrointestinal tract to get excreted, causing constipation along the way. Carbonyl iron is a very unique form of iron. It is not a salt, but rather metallic iron in superfine powder particle form. It dissolves slowly in gastric acid without causing gastrointestinal discomfort, and due to the slowness of dissolution compared to the salts, we are reaching an absorption rate of 69%. And with that, no constipation. As a pharmacist for 25 years, I rarely received calls from medical doctors with questions on nutrients. But since we launched Carbonyl Iron, I receive regular calls from MDs asking, what is this stuff? I've never seen ferritin levels bounce back this fast. If this is of further interest to you, we have more detailed video information in 2 Carbonyl Iron videos on our YouTube channel. Look for Carbonyl Iron Part 1 and Part 2. Oh yeah, and as a final note on iron, you should always base the decision to start supplementation with iron on blood work. Iron, if not needed by the body, can become a catalyst for radical and peroxide production, and nobody needs more of that stuff. Initial blood work will also provide your baseline starting point, allowing you to assess your progress. The next nutrient I find paramount for mother and baby is vitamin D3. Back in January of 2019, long before the pandemic, we posted a video on vitamin D optimization on our YouTube channel. At that time, we wanted to inform you about how to monitor vitamin D levels in your blood to optimize your vitamin D levels to combat SAD, seasonal affective disorder, or osteoporosis. Vitamin D's immune-stimulating properties had not really been on our minds at that time. Today, more and more studies surface connecting good vitamin D blood levels above 75 nanomoles per liter with milder courses of COVID-19 infections in all age groups. But there's also pregnancy-specific angles for vitamin D that need to be discussed. Research connects higher daily doses of vitamin D3 to a reduced risk of preterm labor, preterm birth, and even gestational diabetes. Also a reduced incidence of infections and other complications. Vitamin D deficiency has also been linked to the increase in childhood allergies, and we all witness this stellar rise of environmental and food allergies in our kids today. Finally, we need to cover the effects of proper vitamin D blood levels on our mood. It is clearly documented how dropping vitamin D levels over the winter months can lead to winter blues or seasonal affective disorder, SAD. But there's also growing evidence that postpartum depression is at least partly connected to low vitamin D levels during and right after pregnancy. Keeping vitamin D blood levels at least 75 nanomoles per liter will help stabilize mood and potentially prevent full-blown postpartum depression. I believe if you manage to keep your vitamin D status optimized during and after pregnancy, your baby will benefit in utero and via breast milk, while mom stays stronger and happier throughout as well. So all this said, optimizing your vitamin D levels throughout winter and summer has numerous health benefits for every North American, including pregnant women. And more frequent D testing should become part of mainstream medicine today. Testing should be done while taking a consistent dose of vitamin D3 per day for at least 3 weeks to create steady blood levels. During the winter, we as Canadians practically rely solely on vitamin D3 by supplementation, while during the summer we have to factor in the level of sun exposure depending on the average amount of time spent and skin area exposed, unprotected to sunlight within your lifestyle. Moving on to magnesium. Magnesium is probably the most successful supplement in the market because 80 to 90% of the population is deficient. And because so many people experience benefits quickly, usually within 1 or 2 days of starting magnesium, or starting a good magnesium supplement at least. And this keeps people compliant. They continue to use it. Magnesium deficiency symptoms are constipation, spasms and twitchy eyelids or other twitchy muscles, but also headaches or migraines, chronic hamstring or IT band issues, back pain, insomnia, ... During pregnancy, constipation, spasms, and difficulty to relax are common, and these symptoms can effectively be alleviated, especially with magnesium glycinate. Magnesium is calming and relaxing, regulates our nervous system, helps with sleep and stress, regulates bowel peristalsis, prevents anxiousness, nervousness, restlessness, and irritability. And then there's L-glycine, an amino acid which can also be used by itself to help with anxiousness and relaxation. So why not put these two together into one molecule of magnesium glycinate, which is also highest known bioavailability compared to other magnesium salts. This stuff really works. In addition to strengthening baby's bones and teeth, magnesium works to stimulate enzyme function, regulate insulin, and give better blood sugar control in mom and baby. The RDA, the recommended daily amount for magnesium during pregnancy, is about 50 milligrams higher per day than for a non-pregnant woman. It's about 3 of my capsules per day, and I usually recommend 1 capsule in the morning, 2 caps at bedtime. In fact, many of my customers use this magnesium glycinate exclusively as a bedtime supplement. And again, a prenatal multi will not provide adequate daily amounts. Moving on to B vitamins. Our bioactive B complex, slow release, contains the required amount of active folic acid, next to all the other B vitamins, all in bioactive form. When I set out to formulate this B vitamin complex, I had a few key goals stuck out. The use of already bioactive forms of all the Bs. The individual amounts for each B vitamin had to be calculated based upon clinical applications to ensure that our formula provides the highest daily allowances in a form that is most effective and easy to absorb. and most importantly, the slow-release formulation to further enhance bioavailability throughout the day, while reducing unnecessary peak blood levels, as the case with regular release B-complex products. We are using a simple but very efficient method to make our capsules slow release. And this is a method frequently used in the compounding labs when prescriptions call for extended activity. We use the same material that our veggie caps are made of, a cellulose called hypromellose, in micronized form as the filler for encapsulation. And whenever the first drop of liquid enters this capsule, the hypromellose instantly swells into a gel, and it traps the active ingredients inside its 3D gel structure. And this glob of gel is now swishing and swooshing through the upper parts of the gastrointestinal tract, and only smaller increments of active ingredients get dissolved out of the gel slowly. I'm very proud of this product because we achieved all these goals, and we're also able to fit this complete formula into just 2 caps per day. Stress depletes us of B vitamins, and our daily requirements go up during times of stress, and certainly while providing for a growing baby. At the same time, our diet doesn't always provide even the regular daily amounts, and certainly not the increased requirements during stressful times or pregnancy. B vitamins are water soluble. They flush through us very quickly, which you can see in your urine. It turns bright yellow within 10 minutes of taking a B complex and is usually back to clear within 60 to 90 minutes after taking the product. With our bioactive B complex, the proof is in the pea, not the pudding. You take 2 caps in the morning and you'll still pea yellow when you come home late afternoon. B vitamins are generally non-toxic because they are water soluble. They do not accumulate in our bodies, but they are needed all day long, which is why the slow release formulation is so important and why this product is called a true foundation product that everyone will benefit from. And let's have a quick vitamin B6 excursion. Pyridoxine is a single B vitamin that needs to be mentioned here. B6 combined with an antihistamine, doxylamine, sold under the brand name Diclectin, has been used for decades, prescribed by medical doctors to help with morning sickness, nausea, vomiting during pregnancy. Morning sickness usually occurs during the first trimester of pregnancy, but can sometimes last into the second or even third trimester. And studies suggest that B6 by itself, without the antihistamine, greatly improves morning sickness for many pregnant women. And the feedback we are getting with our B6 50 milligram slow release capsules supports this. I believe it is again the slow release formulation that wins the prize here, providing lower peak levels and more stable blood levels for 4 to 5 hours. B6 in its bioactive form, pyridoxal 5-phosphate or P5P, is part of our B complex formula. The B complex could be used in the morning to provide the broad spectrum of all Bs for the reasons discussed earlier, but if morning sickness becomes a problem, bioactive B6 slow release could be used in addition to the B complex, for example at noon and at bedtime. All safe for mother and baby. So in summary, most prenatal multis, especially formulas like Centrum Prenatal or Materna and the like, are dosed completely sub-therapeutic, except for the folic acid content. Everything else is dosed in sometimes even laughable amounts. For example, Materna uses 2.6 micrograms of regular B12, cyanocobalamin, where a decent bioactive B complex provides 1,000 micrograms of active methylcobalamin. Centrum Materna uses 6 milligrams of regular B5, pantothenic acid, while a decent bioactive B complex provides 200 milligrams of active calcium D pantothenate. And finally, Centrum Materna uses 50 milligrams of magnesium per day, not even specifying what kind, while 495 milligrams of more bioavailable magnesium glycinate would actually make a difference. You can imagine, my wife used a customized vitamin regime during both her pregnancies, and both our kids are clearly the most beautiful and intelligent kids around. Seriously. So I hope this provides you with a better understanding on nutritional support before, during and after pregnancy. For questions, please do not hesitate to email me directly at cyrus@purelovevitamins.com. Thank you for watching.